One. Hello and welcome to KCS Connects. My name is Jack Miller. I'm one of the co-directors of Key Clinical Skills. KCS Connects is our way of helping to connect you with some literature that we believe will be of value to you in your clinical practice. This edition of KCS Connects looks at a paper published in 2020 in the Journal of Musculoskeletal Science and Practice, and it was done by researchers from Hanover, Germany, as well as Perth, Australia. The topic is evidence and recommendations for the use of segmental motion testing for patients with low back pain, and it's a systematic review. Now, just a bit of background here. Motion palpation has been around for a long time, and it's built on the concept that you can palpate the spine as it moves and appreciate whether or not there is excessive, normal, or less than normal ranges of motion on a segmental level. And it's used by different professionals, including chiropractors, osteopaths, and physiotherapists. And it's taught still at some entry to practice programs in Canada, but certainly a lot of the postgraduate programs in orthopedic manual therapy. The question is, we want to understand its reliability and validity. So just a little bit of background here, the graphic on your right-hand side, nice little bullseyes there that help us appreciate the difference between these two. So let's just go through those. So the top left-hand bullseye, you can see the bullets are sort of in the same general region, but out of the bullseye area. And so that is unreliable and invalid. To its right-hand side, where the bullets are scattered just about everywhere, it's unreliable, but it's valid. Straight below it, where the bullets are grouped in the bullseye area, it's both reliable and valid. And the last one over on the left-hand side in the bottom, where they're all grouped together, but again, outside of the bullseye is both reliable and valid. So what the researchers did is they reviewed over 3,500 articles using the Quarrel as well as Quadrus 2 instruments. And they came back with 13 studies with over 700 subjects for final analysis. And what they looked at was manual palpation using both passive intervertebral movement testing, as well as passive accessory intervertebral movement testing and lumbar instability assessment. And the reliability was measured using either the kappa variable or the interclass correlation coefficient. And validity was measured using either positive or negative likelihood ratios. So the results here is that, first of all, for a passive physiological intervertebral movement, there's low recommendations to detect lumbar instability for ruling it in, no recommendations to detect non-lumbar instability, ruling it out, to judge mobility of lumbar segments, to agree on normal versus abnormal lumbar segmental movement, or to track the clinical course over time of abnormal or normal lumbar segmental movements. In regards to passive accessory movement testing, there's moderate recommendations to detect lumbar instability for lack of hypo and hypermobility to rule it in, but no recommendation to detect lumbar instability for the outcomes of lack of hypo or hypermobility. And finally, for lumbar instability, there's moderate recommendation for using the prone instability test, and that's shown to you there on the bottom picture on the right-hand side, to agree on clinical diagnosis of lumbar instability. So the discussion here is, first of all, the evidence regarding the validity and reliability of segmental motion testing is at best poor. And we suggest the use of these results as standalone tests for segmental motion testing really can't be recommended at this point in time. Now, just as the graphic shows you there on the right-hand side, surf at your own risk. So if you choose to use these tools, feel free to do so. However, we strongly recommend that you place any findings or interpretation of the findings in the context of the patient's symptoms or reports and response, the overall evaluation findings, and good, sound clinical reasoning. Now, if you'd like to learn more about this particular article, come visit us at www.keyclinskills.ca, where we have this and lots of other research articles in our research review library, and that's free for you to access at any time. And if you'd like to learn more about the new way of looking at the management and diagnosis of mechanical low back pain, come visit us again at www.keyclinskills, where you can learn about our modern MSK management series. Thanks for your time.